Just as women gathered to support community development in the village, so too do the young, socially minded men. Coming mainly from the poorer sections of the villages, and representing all castes and religious groups, these young men organized themselves into farmers' clubs, learning to work together to plan and carry out programs that benefit not only their families, but also the village as a whole.
I was a law student in Pune when I first heard about the CRHP project in my home village. I had come from one of the wealthier families in Goregaon. So growing up, I never had to worry about food for myself, but I was constantly disturbed about the poverty of so many people in my village. I knew that the Roles were doing good work here, and so after I finished my law degree, I decided to come back to be in the Farmers Club and work with CRHP to improve the lives of the poorest people here. When the Farmers Club first came together, about 40 people showed up, and we decided to start our own development fund. Each of us contributed 5 rupees per month, and CRHP agreed to match our investments. After 1 year, we had enough money to purchase some simple farm tools, and we rented these out to our fellow villagers at a cheap price. Soon, crop productions in our village increased greatly, and within 5 years, we paid back our loan to the development fund.
Members meet often within the village and gather once every 3 months at CRHP, where nationwide experts are brought in to teach them everything from cutting-edge agricultural techniques to how to design effective watershed programs, to how to improve the sanitation and hygiene of their village.
10 years ago, we didn't have any water to drink in the summer. We mentioned this to the government at first, and then to CRHP when they first came to work in our village. With the help of social workers from CRHP, we found a World Bank project to build wells, and the community came together to apply. Soon after, we won the proposal and now have clean water throughout the year.
Additionally, they team with the village health workers to spread health knowledge across the community and to care for the marginalized and oppressed villagers, such as those with leprosy.
At first, I didn't know what leprosy was. I thought it was a curse from the gods, and I used to go to the temple 5 times a day and pray to be cured. Then when our village started working with CRHP, I went to the doctor, learned about the disease, and started treatment. As I recovered, our village health worker helped me to integrate back into the village and to find a job caring for animals.